Okay, today we're going to learn how to fit Lofstrand crutches or forearm crutches and learn how to go from sit to stand from a wheelchair using several methods. So first for the fit, I'm going to have the patient take each of the crutches and you're going to measure the crutch height. The crutch height is going to be adjusted distally and the cuff height is going to be adjusted proximally. The height of the crutch should be from the patient's heel to their greater trochanter. And it should be about 6 inches away from their foot. At about a 45-degree angle anterior and lateral to the small toe. Okay, so when the patient places their hands on the hand grips, their arm should have about 20 degrees of flexion when relaxed. So placing the arms in the cuffs, the walk around process should be about 1 to 1.5 inches proximal to the cuff. Which is good. Also, the cuff can be adjusted for the person's arm by squeezing and opening the cuff. So you want it tight enough so that when the person lets go of the hand grip, it will stay on, but tight enough so that it won't bind or hurt the person. Okay, so the first method from sitting to standing from a wheelchair is going to be the way you would use axillary crutches. So you want to make sure, first of all, that the wheelchair is locked before you do any movement. So we're locked in place. So Kaylin, what I'm going to do is I'm going to have you place your unaffected limb behind and your affected limb in front for a more stable base of support when you're standing up. I'm going to hand you both of the crutches, place them in one hand, and place your other arm on the armrest. And I'm going to place these in front of you. Okay, and you're going to stand up on the count of 3, and then as you stand up, I'm going to have you transfer one crutch to the other arm. Ready? 1, 2, 3. Good. Go ahead and transfer the crutch. Reach over. She's just going to slide her arms in the cuffs and grasp the hand grip. The second method from sit to stand from a wheelchair with forearm crutches is called the turnaround method. So I'm going to act as the patient. Usually what's going to be around the patient is a gait belt. And this method is usually used for people who have KAFOs. So what the patient will do is they'll scoot forward on the seat, and they'll have their KAFOs, and they'll hook the medial side of each into each other. The patient is going to turn to their left, grab the left armrest with their right arm, and the right armrest with their left arm, turn, push up, and place their arms into the crutches. Okay, so Kaylin, I'm going to have you scoot up on the chair. I'm going to grab your gait belt. I'm going to have you turn to the left and reach your right arm to the left armrest and your left arm to the right armrest. And we're going to turn in 3. 1, 2, 3. Okay, support your arm on one armrest and grab from one crutch. Okay, so the third method is called the power method, and this method is going to require the most help of the 3 methods from the physical therapist. So what you're going to have the patient do is take the crutch and place it lateral to the wheelchair in line with the hip. The physical therapist is going to grasp the gait belt and grab the shoulder. The patient's going to scoot forward on the chair. And then to get up, they're going to lean forward, and then they're going to extend their upper extremity while depressing their shoulders in a thrusting motion to stand up. All right, on the count of 3. 1, 2, 3. And at the end, the physical therapist makes sure to push their shoulders backwards while they're standing up straight, and it's important to make sure that the patient has a C curve in their arm. Okay, so some things to keep in mind with all 3 of these methods is that you need to warn the patient what's going to happen before you make any you need to make sure that the crutches fit before any movement is made. It's important that for the regular sit-to-stand method, that can be used for if only one lower extremity is impaired. And the power method and the turnaround method are usually used for those with KAFOs, but can be used for those that don't have them or only one lower extremity issue. It's important as a physical therapist to always keep a secure grip on your patient, and you must be prepared in all sit-to-stands to move as the patient moves and to not interfere with their fluid motion.